Well, hello everyone, and welcome to Sandra L's Wednesday Educational Series. And of course, I am Sandra L, board certified patient advocate, most recently a graduate of the Patient Rising Advocacy Masterclass, as well as your cheerleader when it comes down to making sure that all patients have access to not only access to healthcare, but making sure that access that they get access to is actually optimal healthcare. What does optimal mean? Optimal means the best health care ever. So give me a second and we're going to start on today. So I'm going to start on the information of sharing information for you that you all patients need to be aware of. And the topic of tonight's video is, of course, patient safety. So you might be saying, well, Sandra, what exactly is patient safety? So I'm going to tell you what patient safety is. Patient safety is a 100% error that occurs that it shouldn't occur. It's a 100% adverse event that patients see regularly that they shouldn't see because it could be avoided. It just takes a little bit of, you know, empathy and caring about patients in order for it to actually become something that becomes real. All patients should be safe. Now, there are a couple of patient safety issues that are common, and you might think of it and say, I really never, Sandra, I really never even thought of it like that. And a couple of those are when you're at a hospital and there's one nurse that has to see 10 patients. Well, that's a patient safety issue. Why? Because that one nurse, she isn't going to be able to look after 10 patients. It's a patient safety issue. She's not going to be able to monitor them the way that they need to be monitored. So chances are that there is going to be an error that occurs. Another patient safety issue that a lot of people do not view as a patient safety issue, but it is clinician burnout. Because guess what? If the doctor is really too tired to focus on that patient, then the chances are that there are going to be things that are missed that shouldn't be missed. So those two are in fact patient safety issues. But I'm going to tell you about a patient safety issue that happened. And please pay close attention to this because as the healthcare system evolves and as we see more of AI healthcare, and so you say, Sandra, what is AI healthcare? AI is artificial intelligence. And so basically, what that means for all patients is that a lot of care that we see now that we're getting from our doctors or humans, we're getting that care from them. That care is going to not be offered. And you might say, well, that's crazy. How are we going to get, how if I'm sick, I'm going to find out what's wrong with me? Well, they're programming robots to be able to do all of that fancy stuff that doctors do now. And sometimes it's not even fancy stuff. It's stuff if you have a doctor like I have, I so appreciate her. If you have a doctor like I have, this empathy care. They're caring enough to ask, what's going on? How can we help? What are the, symptoms you're having? Well, in a not too distant future, if you are not paying attention, that not too future distant is now. We're having robots. We'll be having more of them that will be in charge of taking care of us and making sure that we're doing what we're supposed to be doing and doctoring on us. Don't ask me how, because I haven't still figured that part out yet. How they're going to do it without human intervention, but it's here, it's real, and in the communities that MediHelps LLC and the Chom's MediHelps Foundation is specifically geared to help, which are underserved and the marginalized. They're going to be patients that are like shocked out of, what's going on? Where's my doctor? What happened? Because their eyes are closed and no one's really slowly opening their eyes. So it's going to be a shocker to many in the communities that we service. But we're doing our best to get the word out. So now on to patient safety. So guess what happens if robots are in charge of providing that care? Right? And it's going to happen more if robots are providing that care without the correct human intervention, meaning that they're going to have people, they very well could have people who are not trained in patient care taking care of patients. What does that leave us with when we look at patient safety? It gives us a higher realm of knowing that errors are going to exist. Those errors need to be reported so that an end can be put to it and that all patients can become safe when they seek care. Whether they're seeking care through a human, whether they're seeking telehealth care, whether they're going into the doctor's office, what used to be classified as a doctor's office and seeing a traditional doctor and nurse and staff, and now we're seeing robots. We need to be safe, and they need the powers that be need to make sure that no matter how we get our care in a safe care. That's what they need to make sure, right? So back to today's subject of patient safety. So there are some patient safety issues that occur that we don't even look at. We don't even think that they're patient safety issues, right? We have no idea. It's lost to us. It's unfortunate that it's lost to us because these type of patient safety issues that occur can hurt us. The ones that are being overlooked can hurt us more so than we would ever realize. So you're like, Sandra, what are you talking about? Girl, spit it out. So this is what I'm going to tell you. I had a call that was placed to me. I didn't recognize the doctor's name, who they were calling for, so I didn't return the call. But then I started thinking about it, and I was like, you know what? Let me just call this doctor and see what they want. So I let it go another day, and once again they called me like 2-3 days, and without me responding. So I finally said, you know what? I'm going to go ahead and call them because whatever they want is important. But I've never heard of this doctor's name before, so I'm like, maybe they got the wrong patient. So I called, and I was told that they were calling me because my doctor had left the practice and they knew that I was trying to get a medication refill. And I said, I have never even been to your office before. I am a patient of your medical group, but I've never been to your office before. I said, what's happening is that this is a patient safety issue because whatever patient is out there waiting on their medicine is sick and is probably going to get sicker, meaning she's not safe or he's not safe because they're waiting for a call to come from you in reference to this medication refill. Luckily, I was speaking to a practice manager who stated to me, she said, well, how do you know that it's a patient safety issue? But I'm a patient advocate and I do this on a regular. So I know what you're doing. I know what happened. I know what happened, but I also know the most important thing about this event is that it's a patient safety issue because you have my name attached, my information attached to somebody else's file who you need to be calling to make sure that they're okay and they're safe and they've actually getting the medication that they need to have. And I said, and you need to report this as a safety issue. She said, you're 100% correct. She said, more than likely, it was a typographical error. Somebody typed your information in when they should have typed the other patient's information in. I said, you know that, and I know that. But how are we going to fix it? And is this going to be reported as it should be as a safety issue? Her response to me was, Sandra, if you, because at that point in time, she had, she already knew my name, right? But I said it again, so she knew it. She said, if you hear me right now, I'm typing. She said, and I'm typing because I have to type this up. She said, you're 100% correct. I have to type this up as a patient safety issue because it is. Someone out there needs medicine and someone out there is getting sick thinking that they're going to get a call back from the doctor when I've spent 3 days in a row trying to reach you and you're not even the right patient. Exactly. So my point in all of this and my point in today's video is that while there are some patient safety issues that you outwardly see with your eyes, like I said earlier, got one nurse doing, she's working with 10 people. You got one doctor who's like, I am just totally burnt out. You got, stuff you're looking at, workers that are working, floors not mopped, maybe the patient got to get up out of the bed to go to the washroom and the floor is not mopped, or there's garbage overflowing in the room, or anything, or they're not washing their hands, they're not making sure that they're germ free when they're entering your room or speaking to you. Those are obvious patient, those are some, not all. There's no way I will be able to cover all of them on a 15, 20-minute video. Those are some. But what's more important for you as a patient to keep a watch on, and not only do you need to keep a watch on it, but when it happens, you need to bring it to the proper attention of the admin, whether it's at the hospital and you're sending a letter or an email to the CEO, whether it's at the doctor's office and you're bringing it up to the attention of the doctor. Someone of authority needs to know, because they need to be reporting patient safety errors. When they don't get reported, what happens is that you or I or the next patient in line, or maybe it's a child, maybe it's a senior, whoever it is, what happens then is that they also take the risk of having a patient safety error happen to them. And so it goes on and on and on and on. So the next time you're in a doctor's office or you're at a hospital and you see a patient safety issue, or the next time you're sitting at home and you don't call Dr. Smith 2 or 3 days ago and you've never heard anything from him or her, call that office and find out why. Say, hey, I called you 2-3 days ago. I didn't hear anything. I want to tell you to use the patient portal to ask those questions, but there are a lot of facilities that are now charging patients to use the patient portal, meaning that EHR that you go into, that they tell you all the time, hey, send a message through there. They're now charging people. There are certain facilities, and I'm sure more will probably get on board. There are certain facilities that are charging patients to get access to their doctor by using that portal. So keep your eye on that. But more importantly, keep your eye on you put in called your doctor 3 days ago. You haven't heard anything. You asked them to send you medical records and you never got your medical records. Mind you, your medical records now should also include the medical notes from the last time you went to see the doctor, right? So you never got them either. Call them, ask them. Where did you send this to? I never received it. Who are you calling? I never got it. Let them tell you. Make the healthcare team tell you where your stuff is. Make sure that it's in your hands. That's a HIPAA violation. It's a patient safety issue. Make sure that they're reporting it. And if they're not reporting it, you report it. You do one better. You report it. Whether it's you reporting it to them and you don't think that they're listening, or you're using a social media platform such as Facebook or such as TikTok to actually, or LinkedIn, whatever social media you use, make sure the word is getting out that this doctor or this facility or whatever is not following patient safety rules. We have to follow patient safety rules. At this point in time, I'm going to end the video, but what I do want to do quickly is I want to bring up the name of an organization that works directly with, not directly with, but they're focused in on patient safety issue, events that happen. They want to know about them. They want to hear about them. They want you to have a place that you could actually come to and talk to and share what you've experienced when it comes down to that. And it is the takecharge.com. And also the Pulse Center for Patient Safety. Once again, the Pulse Center for Patient Safety. Please, I put the link down at the bottom for the Pulse Center for Patient Safety. Please do visit that website. Look at the items that they have. They go into more detail other than this video. They go into more detail on exactly what is patient safety. They give you tips. They give you tools. They have meetings. Another one of their website addresses also takecharge.care. Please use them. The information will be in the video. So as you view the videos later and you want to know more about that one organization with those two websites, please reach out. But the end of the day, once again, is patient safety. Keep your eye on the obvious as well as the not so obvious, and report both. That's it for today's Wednesday educational video.